Okay, we are live. Just gonna wait a couple seconds here, let a couple more people join in. If you're seeing this, go ahead and drop a comment, tag somebody that you want to join, and we'll wait a couple minutes, wait for them to jump on in with us. Today is Monday. We just started a brand new year, and we're gonna kick it off right. And so I'm gonna be diving into some of the dynamics of shoulder health and rehabilitation. I have a lot of patients over the last 6 months that not only have had previous shoulder injuries, whether that was from a car accident, from old sports, but they've continued to have pain into the shoulder, scapula, and even up into the cervical spine. And so today we're going to be diving into that region specifically. I want to give you guys a couple of tips and things that you can walk away with so that by the end of this class or workshop discussion, we are able to immediately implement things directly into our lifestyle that are going to help it and push it in the right direction. And so, be sure, let's go ahead and share this around, and let me know that you're here. Who else we got going so far? All right. So we got a couple people here. We got my Endless Adventure. Hey, what's up, buddy? I'm gonna drop you a wave. Cool. All right, guys. So when I was 19 years old, I was on my way to playing professional baseball. I had years and years and years of wear and tear on my arm. I was one of the top recruits in my state. And we spent every single day, waking hour, trying to prepare for the goals ahead. So that was getting to college, playing college ball, and then playing professional baseball. That was the goal. That was the dream. And when I was 19 years old, that dream kind of came to an abrupt halt whenever I underwent Tommy John surgery. This surgery, if you're unfamiliar with it, is a repair or replacement of the ulnar collateral ligament. And this ligament is what allows you to maintain integrity on the medial side of your elbow. And whenever we are throwing, we have a high force throwing motion that causes valgus stress onto the elbow and can damage the ligaments in there. And so over time, that just wore down year after year, throwing too many pitches since I was 12 years old and all the way up. Now, before we go any further into throwing programs and shoulder dynamics and how to avoid those injuries, one of the first things I have to mention is we're seeing too many kids, too many young athletes become specialists in their sports before the age of 13, especially in states where the weather's a little bit warmer, like California, Arizona, Florida. A lot of these kids are playing baseball, playing sports, maybe it's basketball, football, whatever, their individual sport year round. And this becomes a big problem, not only from the state of mental burnout, but from physical burnout, repetition on a developing body or developing tissue, say, their elbow, their shoulder, their knees, their ankles, whatever. That common repetition over time can lead to instability if the mechanics aren't properly being performed. And if the young athlete hasn't received the coaching, the proper coaching, but also the proper frequency in which they're supposed to be pitching or throwing or doing their sports. So injuries can take place because of improper movements, from trauma, or from repetition, from just, even if you do something right, if you do it too many times, it can be a problem. And so that's really what we're trying to talk to the parents about now, is getting these kids on a off-season program or playing other sports where they can give their shoulders, their elbows, their bodies time to recover while they're working on some other things. Maybe go play another sport. That's going to be great for helping build the team building skills and just the other neural connections in our brain that allow the development of those different actions. So jumping versus running versus throwing, These are all going to be very important to any athlete. We don't want to just develop a person from a young age to only be able to do one thing. They become very one-dimensional, and that can lead to injuries, as we've already talked about. And so that's one of the things I want to leave the parents with right off the bat is let's make sure, and if you guys have any questions on this, you can message me, DM me. I'd be happy to help out the kids with the throwing program or whatever it needs to make sure that we're getting the information and the content to those people that really are going to benefit from it. And so after I had my Tommy John surgery, I really had to take some time off to recover, do my physical therapy. It was about a 9 to 12 month recovery. I was actually ahead of schedule doing that every single day. Wake up in the morning, starting off with a little therapy, and then doing some physical therapy exercise, and then finishing with some therapy in the afternoon at the training facility on campus. And so I was working nonstop with our trainers, with our doctors, with Dr. James Andrews, who was the head physician for my surgery. And he's also the one that done Tiger Woods' surgery, Bo Jackson, and most of the top athletes work with Dr. James Andrews. And so I was fortunate to be able to have him as my surgeon. And I want to kind of pass down what I learned from his protocols onto you guys so that you have that information available. And so at the end of this video and workshop, I'm going to be leaving the ones that want a throwing program and shoulder rehabilitation program. That's going to be great for not just athletes and baseball players, but people coming off of rotator cuff surgeries or just rotator cuff injuries in general, labral issues, impingements, thoracic outlet syndrome. There's lots of different things that can go on inside the shoulder, as we're going to talk about in a second, because of the anatomy of the shoulder. Now, as we move into it, we have to understand the different types of joints in the body and what their purpose is. Why do we have joints and why do we have muscles? Well, we're meant to move, and the muscles actually contract in a particular fashion to cause the joint to move in a direction. And so whenever we're putting repetitive stress on that muscle is going to be contracting and relaxing in the same pattern. That's using the nerve in the same pathway. That's what becomes muscle memory. But that also, repetitive patterns is going to what causes the tissues in the joints to become elasticy and stretched out and maybe not as tight as they used to be, and that can lead to problems. That can lead to instability or tears eventually. And that's what we want to be able to really hone in on and recognize early in a young athlete's or any person's shoulder progress and prognosis. And so the shoulder joint is the most mobile joint in the body. It is a ball and socket joint. And what that means is the end of the humerus or the humeral head, the top of the shaft, which is right here, goes up into what's called the labral cavity or the glenoid cavity and fits in there like a ball inside of a cup. Okay, and that allows that to move in 180, 360 degrees in all directions. And so that's why my shoulder can move like this in each direction: abduction, adduction, flexion, extension, and internal and external rotation. These are going to be the most important things to remember when we're talking about tissue repair, because depending on which motion we're doing, we're going to be working on that's going to be doing therapeutic exercise for that particular muscle or joint. And so in baseball players, because of the throwing motion and the act of decelerating the humerus and arm as we come across the body after the ball is released, all these muscles in the back of the shoulder, known as the rotator cuff, have to decelerate the arm and slow it down. And this can become very tense and stressful on those muscles. And so when we're doing a rehab program, we have to check the rotator cuff. We have to check the teres minor, teres major, infraspinatus, supraspinatus, and subscapularis muscles. They insert into the humerus from the scapula and from the rib cage. That allows my shoulder to move and rotate. And whenever those don't work as efficiently, injuries can take place deeper into the shoulder itself, inside the capsule, inside the labrum. When things aren't being stabilized in the rotator cuff, it can cause the humeral head to slide around inside that glenoid cavity. And as we know, that can be a very dangerous position to be in when you're trying to do high velocity movements. Whenever you're trying to do any kind of movement, we want to make sure that we're moving properly if we're going to be doing this all the time. So if we're not an athlete, say we're sitting at a computer and we're working at a computer all day, we may not be using a lot of strain on our shoulder, but the physical behavior of leaning forward and sitting in that position for hours can be stressful, because the muscles, the joints, and everything are being compounded, compacted, and loaded and flexing forward and forced to hang out and stay in that position. Now, we don't really think about it much when we're working and typing and working on our papers. But at the end of the day, what do most people have? Tension in the upper trap, tension down here in the rhomboids behind the scapula, and probably tension into the chest as well, up into radiating into the head, into the temporalis muscles of the skull. And so this is huge. This stuff is huge because we know that structure determines function. And whenever we are constantly putting ourselves in a structural compromised position and the biomechanics are being stressed, that equates to a dysfunction. And so when we have dysfunction, that's going to cause pain and irritation and a signal, which is pain, to the brain saying, hey, something is not working properly here. Something's not moving right. Something's not conveying its energy properly. Whenever the brain tells those muscles to contract, is it working? And so that's what we really try to dive into when we do a shoulder exam on our young athletes, but also our professional athletes. How are their bodies able to adapt to the stressful positions that we're placing them in? And what does their rehabilitation or their injury prevention program look like? If we're not doing any kind of injury prevention, if we're not doing any kind of rehab after a very violent and very aggressive motion, like throwing a ball and putting your shoulder back into this deep stretch state, well, when we do that, that's that stretch reflex that kind of sends it back and then we whip it forward. That can be very traumatizing on a young athlete or a young shoulder, a young developing body. And so rotator cuff rehabilitation, injury prevention is going to be absolutely essential to any young athlete. And also we want to make sure that the trainers and the coaches and the other people, parents looking over the athletes, that we are aware of how the anatomy works and how what we're teaching these kids is actually going to play out. Because it's not about being good when you're young. It's not about how many games you win in Little League. If we want to play professional sports, if we want to make it to the collegiate level, we can't have kids burning out at a young age doing ridiculous throwing drills and exercises that they're not ready for yet. So some kids develop early, some kids develop later. And I've seen it where the younger kids that develop later, they actually, because their arms are fresher, because they didn't get abused, they didn't get used up at a young age, because maybe they advanced faster and so they threw harder, they were bigger, stronger, and so they were used more in the sports. And then the late bloomers actually developed more in high school, and they had fresh joints, their arms were fresh, they didn't spend the first 8 years of the sport throwing way too many pitches or playing that sport way too much. And that's another part of it, you guys. It's a balance of training and recovery. We can't just train all the time. We can't just recover all the time. We're only as good as our recovery from our last workout. If we're constantly putting repetition and constantly putting tissue in a stressful state, it's going to either plateau where we're not increasing our performance anymore, which isn't ever a good thing, or it's going to have an injury because of a breakdown in the function. And so understanding the biomechanics, understanding the ball and socket joint of the shoulder, the glenohumeral articulation is going to be absolutely important for any young athlete and person coming off of a shoulder injury. Okay, rotator cuff, labrum, shoulder impingement, thoracic outlet syndrome, these things are all based on biomechanics. there's very few shoulder injuries, unless it's coming from a radiculopathy in the cervical spine, that are from a neurological problem. There might be some people that have nerve damage, maybe from an old injury or some kind of infection or an autoimmune thing. But most of my patients, most people that go to the orthopedist and have these rotator cuff surgeries are because of improper motion, improper usage, and improper biomechanics of that joint. And in doing so, that leads to a breakdown in the tissue. And so, you guys, this is absolutely a great thing to acknowledge to our young athletes, get them started onto a throwing program, onto a rehab and injury prevention program, and talking to them about, you guys, we have to understand, like, we only have so much energy, we only have so much time, so we have to be smart with our training. It's not about training more and doing more reps and going harder and trying harder. It's about using the time that you have and being the best during that time and having efficiency during that time. Okay, and that's something that I know is very hard to understand whenever we're not a professional athlete. We haven't been in that. So for some of these young parents bringing their kids up through the sports, or young coaches, if you haven't been through the injury, and that's why I'm sharing this, is because I've been through the shoulder injuries, I've helped people through the shoulder injuries, and I've had elbow reconstructive surgery myself. And getting onto a program, getting onto a rehab program prior to the injury is what's going to bring awareness to that system so that we can prevent it in the first place. And so at the end of this video, drop me a comment, or if you guys wanted to leave a message in my inbox, I will send you a rehab program for the shoulder, as well as a throwing program for the young athletes in season and off season. And so I just want to close out today with a little question time. If you guys have any questions, you can drop them down into the comments. We are live right now, so you can leave a comment here, and we will field that as we go. If you guys want to message me, we can also talk privately and jump on a call or do a FaceTime and discuss specific shoulders problems and shoulder injuries that might be from whatever it is that you do with a daily your daily activities. And so I like to talk to my patients like they're professional athletes, even if they have never played a sport in their life. And one of my patients, she's amazing teacher. She works at the school all day, second grade teacher. She helps kids, but she grades papers all day on her off days, and it's very hard on the neck and the shoulders. And so I told her, I was like, even though you don't play sports anymore, we have to train the body as if we are an athlete, because we're using our bodies every day to do the things that pay for our lifestyle. And what's the point of waking up, going to work, and paying the bills if you come home just to sleep and feel like crap, or because it hurts? And so we need to be able to do our job and do our life without it completely destroying our body in the process. And so that with that comes training and proper awareness of what I'm doing. So we have to be able to instill practices that are going to be equal to or greater than the stresses that we're placing it under. And so if we're sitting at a computer all day, we have to do exercise. We have to get up and do some therapeutic exercises for specifically our cervical spine, our shoulders, our pecs, or we will probably develop cervical degeneration and different biomechanical problems up here because of stagnant motion and repetition. When we're doing this same position for months and years over and over, it's only a matter of time before that becomes a problem. And so we might as well address it now, might as well get a head start and start taking control of the problem before it becomes pain. And that is another thing, is understanding pain is actually our friend. It's a signal that's telling us, hey, something's not right, something's not good here. You need to cut out the bull crap, whatever it is that you're doing wrong, and get back to the fundamentals, get back to the basics of how this actually works, and then rebuild it from there. It's gaining orientation on myself of where I'm at in space, where I'm at in my life, so that I can feel out the surroundings where am I going next? This is, okay, I set a plan, I see it. Now it's time to execute. Now it's time to lay out those action steps or those behavioral patterns that's going to cause a behavioral change in the tissues. We can't change the way a tissue presents without changing the way we use it. And that goes back to the structure and the function and the anatomy when we talk about joint biomechanics and muscle contraction and being able to use that properly. And that encases the nervous system as well. When we look at the proprioceptive system, where my body is at in space and that awareness, it gets diminished the less that we use our body, the less we use our shoulder. So when we're constantly sitting and not moving around and not getting circulation and neurological feedback into that system, it's going to be more prone to injuries. And so we have to keep the body moving, but most importantly, we have to think about quality of movement, not just going hard. For years and years and years, so many athletes and people, we rate how good we do stuff based on how many reps I do, how much weight I lift, how fast I run, how high I jump, and none of those things really take into account the quality of what I'm doing. And same thing goes into our diet. Same thing goes into most things in our life. We think more in terms of quality, and instead of quantity, we're going to be better off. Less is more sometimes, as long as we're doing it in a proper fashion. I would rather see my patients do things less that are really good instead of trying to do something like a push-up or a squat that's horrible technique a million times. Like that's not proving anything. So we need to make sure that as we're doing our exercises, that we're doing our training and we're going through our programs, that we're really dedicating not just our physical labor, but our mental labor and our mental focus into how we want to execute. Because the more precise that we can be, the better that's going to be long term. If we're just only putting in half effort and we're only putting in half focus into the motion, that's going to translate into the repetition, because after a few reps, our mind's going to get weak and the tissue is going to break down and default back into whatever it is that we know. So we have to dedicate to not only the physical repetition, but the mental repetition. And on each rep, we're really being convicted with what our target is. What is our purpose? What are we trying to do? And it has to be a positive purpose. It has to be something that we can attack. It's not a sense of what I don't want. So for instance, for young pitchers that kind of get in a funk, a lot of times, we get into a repetitious cycles. Maybe they get into a loop, they throw a ball, they get, there's an error, and then something happens, and all of a sudden bases are loaded, no outs, and I'm just like, what's going on here? How did this happen? So being able to break that loop, both physically and mentally, and get back and say, okay, I got to execute. I got to throw a strike right here. Not, oh man, I hope they don't hit the ball. I hope I don't throw a strike. I hope I don't hit this person. That the brain doesn't know what it means to not do something. So if we're always focused on what we don't want, we're never going to execute and be as precise as the things that we actually do want. And in doing so, we miss our target most of the time. So if we just kind of block out the external, remember where we're at and focus on that target, and then execute in a disciplined but free style, it's gonna flow. And as long as we get the body out, the mind out of the way of the body, and we just learn to kind of feel and use that muscle memory and that neurological repetition that we've built up and trust our training, when we get into the game, we should not be worried about any kind of biomechanics. We shouldn't be focusing on our arm angle and what's our balance point and things like that. That's why we do that in practice. When you're in the game, you focus on one thing: throwing the strikes, executing what it is that you're trying to do. And so this has been our shoulder rehabilitation and dynamics talk. If you guys want to go in deeper into the anatomy, the physiology, the actual musculature, and some of the vasculature and things like that regarding the shoulder and your specific injuries, I would love to dive into that. I don't want to go over the top on the content, but more just getting the gist of what it is this talk is actually about. And so we're getting the wheels turning, planting seeds for the future. And then I want you guys to message me if you guys want to really take your shoulder rehabilitation program to the next level, I'll give you the professional shoulder rehabilitation program. Dr. James Andrews gave it to me. We'll give it to you guys for free. Just let me know, send me a DM. Be sure to like this video and share it around with your friends. Hit the save button down on the bottom right and add this to your catalog. We'll go back and look at some of this stuff again later. Wishing you guys the very best and a happy new year. I hope you guys are doing well. Set your goals high and remember to stay positive. I know it's hard out there being isolated and everything's a little bit tense, a little bit crazy right now. So just be patient with yourself. Take your time, cool your jets, and just enjoy the ride. I hope you guys have a wonderful day, and I look forward to seeing you soon.